We talked about risk being an age continuum. So the higher or the higher is your number in age, the more likely you are to encounter C. difficile and develop an infection. So the way the vaccine would help to prevent is if you find that optimum medium where you have the least amount of risk closer to that time that you need the vaccine. And I talk about this because a vaccine is a preventative measure. So it's an intervention that happens before the event actually takes place. So it helps you fight that infection. And that is important because when we look at the risk of C. difficile in the US, individuals 50 and above have a higher risk of developing that disease, and therefore it's important to vaccinate them ahead of that time. So this vaccine will help not only prevent disease, but will fight the toxins that cause the inflammation that leads to all those catastrophic events related to C. difficile. So that's a critical question, I think often misunderstood. I don't think it's better than other interventions. Simple interventions like washing your hands are absolutely critical in stopping C. difficile. And those have been happening in the past, and we managed to actually reduce the burden of C. difficile quite dramatically by reducing the amount of antibiotics used, washing your hands, having better technique in the hospital in handling patients, being able to isolate patients with C. difficile. But all of those combined have not reduced the burden of disease to an acceptable level. There's still over 500,000 cases every year. There's still over 29,000 deaths every year. The vaccine hopefully will help integrate in this package of options and help reduce that number even further. So that's our hope for the vaccine in the future, if we manage to not only show that it's efficacious, but get the acceptability to accept the vaccine intervention and actually utilize the vaccine.